Welcome to Pharmacy Prep, PTCB Mock Exam 1, and Happy New Year 2025. These pharmacy technician certification exams are simulated to mock the PTCB 2025 exams. And this mock exam 1 there are 90 questions. All 90 questions are multiple choice questions and simulated to be similar to actual exams of this PTCB. So let's start. Which of the following is a live vaccine that should not be administered during pregnancy? A. Influenza. B. Varicella. C. Tetanus, diphtheria, pertussis. And D. Hepatitis B. The correct answer is varicella. Varicella is a NMMR vaccines are live attenuated vaccines, and they are contraindicated during pregnancy due to the potential risk to the fetus. Next, which of the following is correctly defines the generic name of a drug? A. Name given by the manufacturer. B. Name for the chemical structure. C. Name of the active ingredient. And D. Name of the therapeutic class. Correct answer is name of the active ingredient is called generic names. Here further details with the example, for example of acetaminophen. Acetaminophen is a generic name which is an active ingredient, and Tylenol is a brand name which is trademark of manufacturer, and then chemical name is N-acetyl para-aminophenol. That's a molecular structure. Rarely you see that in clinical use. Next, which of the following is classified as a Schedule 5 controlled substance? A. Acetaminophen with codeine. B. Pregabalin. C. Hydrocodone with acetaminophen. D. Lorazepam. Correct answer is pregabalin. Pregabalin is a Schedule 5 controlled substance, whereas hydrocodone containing products are Schedule 2 and Tylenol 3 is Schedule 3, whereas benzodiazepine Ativan is Schedule 4. Next, if normal saline is to be infused at 100 milliliters per hour for 12 hours, what is the total volume of normal saline needed? A. 1000 milliliters. B. 1800 milliliters. C. 1500 milliliters. And D. 1200 milliliters. Correct answer is D. Let's see how we get it. So the question provided is, this is the formula. Total volume equals infusion rate times infusion time. So that infusion rate was given in the question, that was 100 milliliters per hour, and infusion time is given in the question. So therefore, if you multiply them, it gives you 1200 milliliters. That's your correct answer. Next, in the National Drug Code, what do the first 4 digits represents? A. The package size, the drug manufacturer or labeler. C. Specific drug product. D. The expiration date. Correct answer is B. This drug manufacturer or labeler are first 4 digits. Here further breakdown for NDC is 10-digit code. For example, for Prozac, it is 100 count bottle of Prozac of 20 milligram. So here first 4 digits are manufacturer or the product, and then middle 4 digits are specific drug, like in this case Prozac, strength, dosage form, and then amount in the package size is 100 tablets. So last two digits are package. Next, which DEA schedule assigned to drug that is used for insomnia, that is zolpidem? Brand name is Ambien. A, Schedule 1, B, Schedule 2, C, Schedule 3, D, Schedule 4. Correct answer is Schedule 4. Like benzodiazepines that and also additionally, benzodiazepine-like drugs such as zolpidem is Schedule 4 drug. Next, how much of 1 to 500 ratio drug aqueous solution can be prepared from 10 gram of powder? A, 5000 milliliters, B, 1000 milliliters, C, 500 milliliters, and D, 50,000 milliliters. Correct answer is 5000 milliliters. Let's see how we got it. So what that means is, if it is a 1 to 500 solution, means 1 gram of drug is dissolved in 500 mils. So if it's a 1 gram is 500 mils, then 10 grams are how many mils? So if you do the cross multiplication, you get 5000 milliliters. That's your correct answer. Next, Dr. John Smith is a physician with a DEA number AS1234563. The second letter S indicates A, registrant type, B, first letter of the prescriber's last name, C, first letter of prescriber first name, D, all DEA numbers with A or as the first letter. Correct answer is B. The first letter of prescriber last name is the second letter in DEA numbers. Let's break down here. So here A is a first registrant type, and the second one is last name, first letter of the last name, in this case Dr. Smith. S is a first letter of the Smith, and then 1 to 6 here are unique identifier for a drug, and then checksum that gives you, if you add 1, 3 plus 5 digits, and then 2, 4, 6 digit, add this together, and then the last letter of number 3 have to match to these two results combination. So it matches in this case. So therefore, this case, it is a valid DEA number. Next, which of the following is not required an individual unit dosage package? Drug name and strength, B, expiration date, D, lot number, C, lot number, D, national drug code. Correct answer is national drug code. National drug code is not required for unit dose. Instead, you need to have drug name, strength, expiration date, and lot number. Next, alprazolam, Xanax, is a benzodiazepine class of drug. According to DEA, it is a correct answer is Schedule 4. Like Schedule 4 drugs are alprazolam or benzodiazepines, plus additionally zolpidem, tramadol, modafinil, also part of these Schedule 4 drugs. Next, which is commonly used in a drug packaging to absorb moisture and maintain drug stability? A, desiccant, B, preservatives, C, emulsifier, D, colors. Correct answer is desiccant. Next, Tresiba is a long-acting insulin. What is the generic name? A, Glargine, B, Levemir, C, Degludec, and D, insulin NPH. Correct answer is degludec. There are other long-acting insulins. Brands are Tresiba, Lantus, Levemir, Toujeo, and Basalgar. Next question. The usual high dose of amoxicillin is 90 milligrams per kilogram per day for the treatment of ear infection. What is the dose for a child weighing 22 pounds? A. 260 milligrams, B. 900 milligram, C. 200 milligram, D. 400 milligram. Correct answer is 900 milligram. Let's see how we got it. So first convert 22 pounds to kilogram, and that can be done by dividing by 2.2, and then you get patient body weight. Here is 10 kgs, 10 kilogram. So multiply 90 milligrams per 10 kilograms, so it gives you 900 milligram per day. Next, which of the following drug dispensing errors can cause serious harm to the patient? A. Atorvastatin, B. Amoxicillin, C. Novolin, D. Metformin. Correct answer is Novolin. Novolin is an insulin. Novolin is combination of insulin, which is considered as a high alert drug. The dispensing error can cause serious harm to the patient. Next, which drug recall classification mean that product can cause serious adverse drug reaction? A. Class 1 recall, B. Class 2, C. Class 3, and D. Class 4 recall. Correct answer is Class 1 recall. Class 1 recalls are considered as a high, risky, or causing serious harm or death, whereas Class 2 is a moderate. Class 3 recalls are considered as a minimal health risk. Next, which antidiabetic drug is indicated for weight loss? A. Semaglutide, which is brand is Wegovy, B. Metformin, C. Glargine, D. Sitagliptin. Correct answer is semaglutide. Semaglutide comes with a brand called Wegovy. This brand is used for treatment of weight loss. However, semaglutide also comes with the Ozempic brand that is used for treatment of diabetes. Next, which book contain therapeutic equivalence codes to determine if generic product can be substituted for brand name? A. Purple book, B. Orange book, C. Red book, and D. Green book. Correct answer is Orange book. Orange book provide therapeutic equivalence codes, which means generic drugs can be substituted for brand name. Purple book contain biological product, red book is drug pricing, green book is for animal product. Next, which of the following should be included in auxiliary labeling for metformin? A. Take empty stomach. B. Avoid grapefruit juice. C. Avoid prolonged exposure to sun. D. Take with food. Correct answer is take with food. Metformin auxiliary label should include take with food, whereas atorvastatin should include avoid grapefruit juice. Levothyroxine should have a take an empty stomach. Next, which DEA form is used for reporting the theft or loss of the controlled substance? A. 222 form, B. 41, C. 106, D. 224. Correct answer is DEA form 106 is used for reporting loss or theft, whereas 41 for destruction or return products destruction of return products, whereas 222 is used for Schedule 1 and 2 substances. and Schedule 2024, 224 is for registering new registrant for controlled substance. Next, which of the following acts restrict access to the private medical information, protects, assures, and patient confidentiality? Correct answer is HIPAA. HIPAA, which is the Health Insurance Portability Accountability Act, it does protect the privacy and security of individual health information. Next, what size of bottle for eye drop is needed for the description GT2S 2OUQID for 7 days? Correct answer is 6 mils. So let's see how we got these 6 mils. The prescription GTTS 2OU means both eyes, 2 drops in each eye 4 times a day for 7 days. If you multiply 4 drops 4 times 7 days, it gives you 112 drops. And 1 mil has, by default, 1 mil has 20 drops. So therefore, 112 drops divided by 20 drops gives you 5.6, which is equal to 6 milliliters. Next, how many grams of hydrocortisone powder is required to prepare 2 ounces of 2.5% hydrocortisone? A. 2.5 grams, B. 2 grams, C. 1.5 grams, and D. 1 gram. Correct answer is 1.5 grams. 1 ounce is 30 grams, 2 ounces is 60 grams. So 2.5% means 2.5 grams for 100. And now 60 grams is how much? So if you calculate that, cross multiply it, it gives you 1.5 grams. Next, how many millimoles of sodium chloride are present in 1 liter of 0.9% sodium chloride solution? And sodium chloride molecular weight is 58.5 grams. A. 90, B. 900 millimoles, C. 154, and D. 15 millimoles. Correct answer is 154 millimoles. Next, let's see how you got it. 0.9% means 0.9 grams for 100 mils. So for 1000 mils will be 9 grams. And apply this millimole formula, such as milligram divided by dose divided by molecular weight. So 9000 milligram divided by 58.5, that is molecular weight of sodium chloride in millimoles. So it gives you 154 millimoles. Next, a prescription of fluticasone inhaler 100 microgram BID for 3 months, and content each of inhaler is 60 dosages. Pharmacists should dispense A. 4 inhalers, B. 6 inhalers, C. 3 inhalers, D. None of the above. Correct answer is 3 inhalers. So 2 dosages per day means for 1 month, 30 days, to 60 dosages. So 1 inhaler is for each month. So for 3 months would be 3 inhalers. Next, how many clindamycin 150 milligram capsules are needed to compound 150 mils of 100 milligram per 5 ml liquid? A. 50 capsules, B. 25 capsules, and C. 20 capsules, and D. 10 capsules. Correct answer is 20. So here it says 100 milligram 5 mils. 5 mils contain 100 milligram. So now you are preparing for 150 mils. So 150 mil contains how many? So if you do this cross multiplication, it gives you 3000 milligram. So each capsule is 150 milligrams. So just divide 3000 by 150. So it gives you number of capsule, that is 20. Next, what is the primary function of antioxidant in a drug formulation? A, to improve the taste. B, to enhance the absorption of the drug. C, to prevent oxidation of active ingredient. And D, reduce the viscosity of formulation. The correct answer is C. Antioxidants are added to the formulation to prevent active drug oxidation. Next, what is the sales price, which is also same as retail price of a prescription drug with cost of, which is the average wholesale price, which is $19.50, and then markup of 8%, and dispensing fee is $9.50. So what is the sales price? 19 A, $19.50, B, $30.56, C, $9.50, and D, $1.56. Correct answer is B. So here, simplified, the formula is retail price equals cost plus cost times markup plus dispensing fees. So in the given question, the cost is $19.50 and the markup is 8% and dispensing fee was $9.50. These are given in the question. So now you just calculate markup and then cost. So it is a markup would be $1.56. So the retail price is $19.50 plus cost into markup is $1.56 and then prescription fees is $9.50. Together it gives you $30.56. Next, which of the following prescription contain high alert drugs and dangerous abbreviation? A. Ceftriaxone 1 gram IM. B. Warfarin 5 milligram daily. C. Furosemide 40 milligram. D. Albuterol 2 puffs BID. Correct answer is warfarin 5.5 milligram daily. So warfarin is considered as a high alert drug, and then 5.0 is considered as trailing zero. You should not write trailing zero because the trailing zero can be mistaken for 50. So that's a wrong. So therefore that's a dangerous abbreviation. So this option B has a both dangerous abbreviation and also high alert drug in one option. Next, what is the direction for following SIG code for GTTS or PO every 12 hours as the UD? A. Give 4 drops orally every 12 hours as directed. B. Give 4 drops orally every 12 hours as needed. C. Give 2 tablespoonfuls orally every 12 hours as directed. D. Give 1 tablespoonful orally every 12 hours as directed. The correct answer is A. So here breakdown of those directions. GTTS is for drops, PO by mouth every 12 hours, and UD for direct, as directed. Next, if the dose of drug is 0.5 milligram per kg per day, how many milligram will be a 35-pound infant receive per 24 hours? A. 8 milligram, B 7 milligram, C 3, and D 9 milligram. Correct answer is 8 milligram. So here how we got it. 1 kilogram equals 2.2 pounds. So therefore here convert pounds to the kilogram, that becomes 16 kilogram. Dose calls for 0.5 milligram per kilogram. So therefore multiply with 16. So you get 8 milligram per day. Next, acetaminophen elixir USP is particularly useful as a pain reliever for which group of patient? A. Elderly patient. B. Pediatric patients. C. Pregnant patients. D. Patient with chronic pain. Correct answer is pediatric patients. So acetaminophen elixir is liquid formulation designed for easy administration, especially suitable for pediatric patients who may have a difficulty to swallow the tablets or capsules. Next, inhaler contains 120 dosages. How many days the patient will take to finish entire inhalers with his SIG code? Use 2 inhalers in each nostril every morning and bedtime. A. 7 days. B. 10 days. C. 20 days. And D. 15 days. Correct answer is 15 days. So here is a breakdown of those. So 2 nostrils twice daily, morning and night, and then 8 dosages total daily. So total 100 total dosages divided by 8 dosages give you days supply, that is 15 days. Next, what does a solution expressed as a 30% weight by volume indicates? It means 30 grams, A, 30 grams of solute in 100 ml of solution, B, 30 ml of solute in 100 ml of solution, C, 30 grams of solute in 100 grams of solution, and D, 30 ml of solute in 100 grams of solution. Correct answer is A, 30 grams of solute in 100 ml of solution. That means 30%. So here, weight by volume. So solution indicate the number of grams, which is 30 grams of solute in 100 ml of solution. Next, a prescription for amlodipine was mistakenly entered with amiloride in the computer. To prevent such error, which ISMP recommendation should be implemented? A. Generic and brand name. B. Increase the dose frequency. C. Store both drug separately. D. Use generic names only. Correct answer is use both generic and brand name to minimize those prescription entry into the computer. Next, a liter of IV bag fluid is infused. The rate of flow of IV is 100 drops per minute using drop factor 10 drops per ml. How many hours are required to infuse the liter? 1 hour, B 1 hour 30 minutes, C 1 hour 40 minutes, and D 2 hours 30 minutes. Correct answer is C 1 hour 40 minutes. So here you got flow rate formula and then plug in those 1 liter and 100 drops per minute and you have a 10 drops per ml. So it gives you 100 minutes. So if 100 minutes means that is equals to 1 hour 40 minutes. Therefore answer is 1 hour 40 minutes. Next, which of the following drug cannot be added into the hospital drug formulary? Mean you look for something that is expensive drug, that is. So among these given drugs, which one is more expensive? A, drug A, drug B, drug C, and drug D. Correct answer is drug C. Drugs, if you look at the each total cost, total price, $6, B is 7.5, drug C is at 10.5, $10.50, and drug D is the $7. So most expensive one is C, and least expensive one is C, A. The correct answer here is drug C, that is the most expensive. Next, which federal law defined two specific medication categories as a prescription and over-the-counter drugs? A. Food and Drug Cosmetic Act. B. Durham-Humphrey Amendment. C. Kiefer-Harris Amendment. D. Obra Act. Correct answer is Durham-Humphrey Amendment. Durham-Humphrey Amendment distinguished between prescription and over-the-counter medications. Next, when water is required as an ingredient in a non-sterile compounded preparations and the type of water is not specified, which type of water should be used? A. Sterile water. B. Tap water. C. Purified water. And D. Sterile water for injection. The correct answer is purified water. Purified water, according to USP, purified water is recommended when type of water is not specified for non-sterile preparations. Next, a patient is ordered to receive 1 liter of normal saline over 8 hours. Calculate the flow rate. A. 50 mils per hour. B. 100 mils per hour. C. 125 mils per hour. And D. 150 mils per hour. Correct answer is 125 mils per hour. Let's see how can we do that one. So this is the formula for flow rate. Flow rate equals volume of IV divided by time infused. So here volume is 1 liter, which is equals to 1000 milliliters, and time is 8 hours, so therefore it gives you 125 mils per hour. Next, a child weighing 44 pounds is prescribed a medication at a dose of 5 milligram per kg per day. The medication is available at 50 milligram per ml. How many mils should be administered? A. 5 mils, B. 2 mils, C. 4 mils, and D. 10 mils. Correct answer is 2 mils. So here dose calculation based on the body weight. So body weight was 20 kgs, which was 44 pounds divided by 2.2 gives you 20 kgs. And now 20 kilogram multiplied by 5 milligram per kilogram, so it gives you 100 milligram. So therefore, and total 100 milligram divided by 50 milligram per ml. So that means you will have 2 mils. Correct answer is 2 mils. Next, Lantus 100 units per ml, dispense pen 15 mils pen, and then direction 50 units subcutaneous every PM, every evening. So one Lantus pen is for how many days supply? A. 50 days, B. 40 days, C. 30 days, and D. 10 days. Correct answer is 30 days. So each pen has a 15 mils, so 100 units per mil. So that means 1500 units total. So patient takes 50 units per day. So that means divide 1500 units by 50 units, so it gives you 30 days. Next, prescription for liraglutide, Victoza, pre-fill pen, which is 18 milligram per 3 mils. Direction is 1.8 milligram subcutaneous daily. How many Victoza pens are dispensed for 30 days supply? A, 1 pen, B, 2 pens, C, 3 pens, and 4 pens. Correct answer is 3 pens. So here you have 1.8 milligrams every day, and each pen has 18 milligram. So daily dose is 18, 1.8. So 18 divided by 1.8, so it is good for 1 pen, good for 10 days. So for 30 days, you needed 3 pens. Next, a child weighing 33 pounds is prescribed amoxicillin at 50 milligram per kg per day and divided dose every 8 hours. Calculate the dose per administration. A, 750 milligram per dose, B, 500 milligram, C, 250 milligram, and D is 50 milligram. Correct answer is 250 milligram per dose. So here 33 pounds equals 15 kilogram. And now body weight times dose, which is 15 milligram kilogram, and body weight is dosage is 50. So it's 750. However, question is asking per dose. Per dose means 3 dosages per day. So 750 divided by 3, that gives you 250 per dose. That's your correct answer. Next, what is the days supply for this prescription? Timolol 0.25 solution 1 GTTOU twice a day 5 mils. A, 5 days, B, 10 days, C, 15 days, D, 25 days. Correct answer is 25 days. So if you look at that, 1 mil has a 20 drops. So patient direction is 2 drops per twice day, which is 4 drops. So therefore, that contains 5 mils. 5 mils is equals to 100 drops. So total 100 drops. Patient take daily 4 drops, so it gives you 25 days supply. In pharmacy billing, what does that term copay means? A, fixed amount of the patient pays for covered healthcare services. B, percentage of the cost covered by healthcare services. C, total amount of the patient can pay out of pocket. And D, the amount of pharmacy has to pay to join insurance network. Correct answer is fixed amount patient pays is a copay. Next, a vial of antibiotic ceftriaxone is supplied as a powder. The label indicates that adding 10 ml of sterile water will yield concentration of 100 mg per ml. A patient needs 250 mg of the dose. Calculate the volume needed for the required dose. A, 2.5 mils, B, 5 mils, C, 10 mils, and D, 25 mils. Correct answer is 2.5 mils. So here, parenteral dosing calculations, that is desired dose by concentration. So here, desired dose is 250 milligram and available is 100 milligram concentration. So it gives you 2.5 mils. So that means you have to draw 2.5 mils to get 250 milligram from the vial. Next, a patient with a history of lisinopril-induced angioedema should avoid which drug? A, losartan, B, metoprolol, C, ramipril, D, hydrochlorothiazide. Correct answer is ramipril, because all ACE inhibitors have likely can cause angioedema side effect. So therefore, if someone has a history of angioedema with ACE inhibitor, they should avoid other ACE inhibitor. In this question, the ACE inhibitor is ramipril. Next, a patient prescription of antibiotics, sulfamethoxazole, trimethoprim, which is a Bactrin brand, should be taken precaution in A. Patient with a history of sulfa allergy. B. Patient with a history of aspirin allergy. Patient with history of penicillin allergy. Patient with history of peanut allergy. Correct answer is sulfa allergy. Sulfamethoxazole, right? That has a sulfa group in it. So therefore, that has a cross allergy to sulfamethoxazole. Therefore, other drugs, some of them also have a sulfa allergy, or hydrochlorothiazide, furosemide also should be avoided. Next, what is the generic name of the brand drug Actonel? A. Risedronate. B. Alendronate. C. Etidronate. D. Pomedronate. Correct answer is Risedronate. What is a proper Tolman letter for differentiating daunorubicin and doxorubicin? A. Dano and doxorubicin. B. Dano and doxo. C. Rubicin. D. Daunorubicin and doxo. Correct answer is Dano and doxorubicin. So the common rubicin should not be capitalized. The difference, Dano and doxo, should be capitalized. Next, which of the following is an antidiabetic drug class DPP4 inhibitor drug? A. Semaglutide, brand Ozempic. B. Sitagliptin, Januvia. C. Canagliflozin, Invokana. And D is liraglutide, Victoza. The correct answer is sitagliptin. Like sitagliptin is DPP4 inhibitor, whereas semaglutide is GLP-1, canagliflozin is SGLT2 inhibitors. Next, which medication is contraindicated within 24 hours of taking isosorbide dinitrate? A. Aspirin. B. Metoprolol. C. Sildenafil. And D. Atorvastatin. Correct answer is sildenafil. Sildenafil should be avoided within 24 hours of taking all the nitrates such as isosorbide dinitrate and also nitroglycerins because it can cause serious low blood pressure or hypotension. Next, what does hyperlipidemia refers to? Hyperlipidemia refers to elevated levels of lipids or lipoproteins in the blood. And which is high lipids means that's a lipid protein such as LDL, which contains cholesterol and triglycerides, and which can be a significant risk factor for cardiovascular diseases. Next, why should a person on insulin therapy be advised to rotate their injection site? A. To increase absorption. B. To prevent development of scar tissue and lipodystrophy. C. To enhance the potency of insulin. D. To avoid bruising at injection site. Correct answer is B. To prevent the development of scar tissue and lipodystrophy, which could be associated with insulin injection site. Next, Yaz or Yasmin is contraindicated, as combined oral contraceptive contains A. Norethindrone ethinyl estradiol. B. Drospirenone ethinyl estradiol. C. Levonorgestrel ethinyl estradiol. And D. Ethinyl estradiol etonorgestrel. Correct answer is drospirenone. And ethinyl estradiol combination is Yaz. Next, how much active ingredient is required to make 50 grams of 6% cream? A. 6 grams. B. 3 grams. C. 9 grams. D. 12 grams. Correct answer is B. 3 grams. Let's see how we got that. So here we have 6% means 6 grams in 100. So therefore, for 50 grams is how much? So if you do the cross multiplication, it gives you 3 grams. So that's your answer. Next, which vitamin is commonly supplemented during pregnancy for nutritional support? A. Vitamin C, B. Vitamin B12, C. Folic acid, D. Vitamin D. The correct answer is folic acid. Folic acid is a critical supplement during pregnancy because it helps to prevent neurotubule defects in development of fetus. Next, what alcohol concentration is defined as alcohol USP? 70% ethanol, 90% ethanol, 95% ethanol, 100% ethanol. The correct answer is 95% ethanol is labeled as USP, alcohol USP. Next, what is the term injection administered into the spine? A. Intramuscular, B. Subcutaneous, C. Intravenous, D. Intrathecal. Correct answer is intrathecal. Intrathecal is administered directly into the spine. Next, what is the maximum daily amount of pseudoephedrine that can be purchased under the federal law? 1 gram, 3.6 grams, 9 grams, or 12 grams? Correct answer is 3.6 grams. Because under the Combat Methamphetamine Epidemic Act, federal law limits 3.6 grams per day maximum purchase of pseudoephedrine and monthly maximum 9 grams. Next, what is the maximum number of refills for non-controlled drugs? A. 3, B. 6, C. 11, D. 12. Correct answer is 11. 11 maximum number of refills permitted for non-controlled drugs. Next, what is correct direction for SIG code Tobradex 1GTT ODQID? Instill 1 drop in left ear 4 times daily. B. Instill 1 drop in both ear 4 times daily. C. 1 drop in right eye 4 times daily. And D. 1 drop in left eye 4 times daily. Correct answer is C. Instill 1 drop in right eye. OD is right eye 4 times daily. Next, which antibiotics is commonly associated with the risk of developing pseudomembranous colitis as a severe side effect? A. Clindamycin, B. Metronidazole, C. Sulfamethoxazole trimethoprim, and D. Amoxicillin. Correct answer is clindamycin. Clindamycin has a higher risk of having the side effect of pseudomembranous colitis. Next, which is a common side effect of vancomycin, particularly when rapidly administered intravenously? A. Reedman syndrome, B. Blue skin discoloration, C. Yellow skin vision, D. Green urine. Correct answer is Reedman syndrome. Can occur if rapidly administration of vancomycin IV. Next, what drugs are used for preventing gastric ulcers associated with the long-term use of NSAID? A. Antacids, B. Acetaminophen, C. Proton pump inhibitors, and D. Antihistamines. Correct answer is C. Proton pump inhibitors. Proton pump inhibitors are used for preventing gastric ulcers associated with the NSAIDs like Brufen, naproxen, and so on. Next, empagliflozin Jardiance brand belongs to which class of antidiabetic drug? A. GLP-1 agonist, B. SGLT2 inhibitor, C. DPP4 inhibitor, and D. sulfonylureas. The correct answer is B. SGLT2 inhibitor. Next, a pharmacy technician received a following prescription that contain omeprazole, metformin, and clopidogrel candesartan. What is the pharmacist technician concern? A. Drug interaction between clopidogrel and omeprazole. B. Drug interaction of metformin clopidogrel. C. Drug interaction of omeprazole candesartan. D. Drug interaction of metformin and candesartan. Correct answer is A. Drug interaction of clopidogrel and omeprazole is a concern. Next, what class of drug side effect increase the risk of infection? A. Antipsychotics. B. Corticosteroids. C. Antidepressants. And D. NSAIDs. Correct answer is corticosteroids. Corticosteroids are works like immunosuppressants and they can cause infection. Next, what color changes can occur in urine when patient taking antibiotic nitrofurantoin? A. Uh, urine from rust yellow to brown. B. Discoloration of urine to orange red. C. Discoloration of urine to blue. And D. Discoloration of urine to bright red. Correct answer is A. Discoloration of urine from rust yellow to brown, which is caused by the nitrofurantoin. Next, which of the following is the common side effect of azithromycin? A. Hypotension. B. QT prolongation. C. Hair loss. D. Hyperkalemia. Correct answer is QT prolongation. QT prolongation is a cardiovascular side effect which can increase the risk of arrhythmias. Next, what is the commonly prescribed for men with erectile dysfunction? Metformin, sildenafil, atorvastatin, valsartan. Correct answer is sildenafil. Sildenafil is used for erectile dysfunction. Next, oral thrush is what type of infection? A. Viral, bacterial, yeast, fungi, or parasite. Correct answer is yeast and fungi infection. Next, a patient presents to a pharmacy with a blood pressure of 160/90. How are these figures most accurately described? Hypotension, hyperglycemia, hyperuricemia, and hypertension. This is the 160/190 is considered as a high blood pressure. Next, rivaroxaban is a direct factor 10A inhibitor and works like a blood thinner. What is the common side effect of blood thinner drugs? A. Nausea. B. Bleeding. C. Diarrhea. D. GI irritation. Correct answer is bleeding. All anticoagulants can increase the risk of gastrointestinal bleeding. Here are some of the anticoagulant called direct acting oral anticoagulants like Xarelto, which is a rivaroxaban, Eliquis, which is apixaban, and there are two more direct acting anticoagulants. Next, ondansetron brand Zofran is indicated for the treatment of A. Migraine headache, B. Nausea vomiting, C. Moderate to severe pain, D. Cancer treatment. B. Nausea vomiting. Ondansetron is used for treatment of nausea vomiting. Next, lamictal lamotrigine is one of the drugs most commonly included on look-alike, sound-alike LASA drugs warning list. And it is confused with which drug? A. Lamisil, which is terbinafine, Lasix, Plavix, and Loperazole. Correct answer is Lamisil. Lamisil and Lamictal sound alike names, and they can be mistaken for each. So therefore, they have to be separated by Tallman lettering. That is, lamictal is Lamy and Lamy is same. So CTAL, SIL have to be capitalized. Next, what is a gauge? Thickness of needle, length of the needle, volume of the needle, and the diameter of the needle. Correct answer is the diameter of needle. So here they are measured into the diameters, and there are various diameter needles are available. Next, what medication is commonly used for opioid-induced constipation? A. Loperamide, B. Senna, C. Docusate sodium, D. Ondansetron. Correct answer is Senna. Senna is a laxative that is used for prevention and treatment of opioid-induced constipation. Next, the morphine sulfate correct expression is MOS, MSO4, MgSO4, or morphine sulfate. Correct answer is morphine sulfate because MSO4 and MgSO4 or MOS can be mistaken for wrong drugs. So therefore, recommended to use morphine sulfate. Next, a patient reports unusual dangerous side effect from a medication. The pharmacist reports information to FDA MedWatch website. This is referred as A. Medication incident reporting, B. Adverse drug reaction reporting, C. High alert drug incident, D. FDA clinical report. Correct answer is B. Adverse drug reaction reporting. Next, when measuring liquid in a meniscus, at which level should the measurement be taken? A. Bring your eyes to the same level measuring cup. B. Bring your eyes to the above level of measuring cup. C. Bring your eyes to the lower level of measuring cup. And D. Bring your eyes to bottom level of measuring cup. And bring your eyes to the above level measuring cup. Sorry, the correct answer is supposed to be bring to the same level of measuring cup. Like here in the diagram, it shows. Pour the liquid, medication, and flat surface and medication level, bringing to your eyes to the same level of the cup. Always measure the medication using the lowest point of the curvature, not the edge. So here have to be, correct answer is A. This is the correct answer. Bring to the same level and maintain those levels. Next, in laminar flow hood, HEPA filter remove particles and microorganisms with a minimum size of what? A 0.3 micrometers, B 1 micrometer, C 5 micrometers, D 10 micrometers. Correct answer is 0.3 micrometers or 0.3 micrometers particle size are filtered out by the HEPA filters. Next, tinea pedis is also known as A. Athlete's foot, B. Ringworm, C. Jack itch, and D. Nail fungus. Correct answer is athlete's foot. Athlete's foot is caused by tinea pedis infection, whereas ringworm is for other part of the body infection. Jack itch is fungal infection in the groin area, and onychomycosis is a nail fungal infection. Next, a pharmacy having a sale of over-the-counter product like markdown to 25% for product with a regular price of $15. What will be the selling price of this item? A, $11.25. So let's see how we got those $11.25. So here $15 and marked down to 25%. So that means 25% means 25 in 100. So it comes to be $3.75. And now $15 minus $3.75, then your selling price is $11.25. That's your correct answer. What is the markup percentage for over-the-counter product costs $3.99 and sells for $6? A, 40%, B, 50%, C, 60%, D, 70%. Correct answer is B, 50%. Here how we got it. Markup formula is retail price minus cost and cost in by 100. So given question has retail price is $6 and cost is $3.99. So if you multiply that with 100, it gives you 50% of markup. Next, which drug is associated with the adverse effect of grayish black tongue and dark stools? A. Brufen, B. Bismuth subsalicylate, C. Naproxen, and D. Omeprazole. Correct answer is bismuth subsalicylate. Can cause side effect of black tongue and dark stools. Next, which type of liquid medication typically requires shaking before administration? A. Solution, B. Suspension, D. Elixir, and C. Elixir, and D. Syrup. Correct answer is suspension. All suspension need shaking before use because this contain particles in liquid. Next, which asthma device requires shaking before use? A. Dry powder inhalers, B. Meter dose inhalers, C. Nebulizers, and D. Handyhalers. Correct answer is meter dose inhalers. Meter dose inhalers, which is aerosols, mean particles in the gas, so therefore they need a shaking. Whereas dry powder inhalers and nebulizers do not require shaking because they have there's dry powders in it. Next, which of the following can be performed by a pharmacy technician that does not require a pharmacist's intervention? A. Adverse drug reaction reporting, B. Vitamin supplement recommendation, C. Prescription data entry, and D. Drug utilization review. Correct answer is prescription data entry, which can be done by independently by the pharmacy technician, however, checked by the pharmacist later. Next and last question of this test is valacyclovir brand Valtrex is indicated for what? A. Urinary tract infections, B. Herpes viral infection, C. Gonorrhea, and D. Vaginal candidiasis. Alright, so our correct answer is herpes viral infection. Valacyclovir is used for herpes viral infection. With this, thank you for watching and stay tuned for more tests and subscribe Pharmacy Prep channel for more tests and for PTCB exams questions and answers. Until then, take care. Thank you.